The Centers for Disease Control and the American College of Sports Medicine issue recommendations for participation in physical activity, and that recommendation is 30 minutes of moderate intensity physical activity most days of the week, which we say is at least 5 days of the week. And our research findings seem to fit with that that really is a sound number to give people in terms of what you should be trying to do as a minimum for your physical activity level. Previous studies have shown that physical activity was protective against colon cancer, and we found that again in our study, but then we took it one step further and looked at specific type of physical activity, which is walking, because it's the most common physical activity among women. And we found that women who participated in walking could also reduce their risk of colon cancer. So we think this is important because a lot of women were perhaps under the assumption that they had to be jogging or participating in something quite vigorous in order to reduce their risk of colon cancer. And our study indicates that that may not be necessary. Obviously, one of the things is physical activity is going to change your body weight and your body composition, but we actually looked at that, and so we are seeing an effect that's independent of the effects that it might have on obesity or your weight. But physical activity is also going to affect the insulin pathways, so it's going to change your risk of hyperinsulinemia and those factors that are going to increase your risk of colon cancer. It's going to have some anti-inflammatory effects, and we've seen indications that inflammation in the colon can increase your risk of colon cancer. So physical activity could be acting through that. It may be having some immune response, so maybe boosting your immune response to help mount a response to something that happens in your colon. And then some indication we've seen is that it might change the transit time in your colon. So if you're more physically active, waste is going to move through your colon faster. So if there's something in that waste that's carcinogenic or that may have a negative effect on the cells in your colon, it's going to be exposed. Your colon's going to be exposed to those things for a shorter period of time.